Perfect. Hi, everyone. Welcome to another episode of Equilibrium. I'm your host, Bria, and I'm here with Dr. Cook. How are you, Dr. Cook?
Good. I'm doing good. How are you?
Good. Thank you so much for being on the show. So today we're going to be talking all about hormones and how you help your patients deal with their imbalances and everything like that. So if you could just tell us a little bit about your background.
Sure. My name is Dr. Beth Cook. I have a practice here in Spring, Texas, which is part of Houston. And I'm trained as a chiropractor. So I graduated from chiropractic school in 2010. And then I joined the Wellness Way in 2016. And so I adjust patients in the office, but the bulk of my practice is testing women's hormones and checking underlying health conditions and things like that. I'm not treating anything. I'm just kind of figuring out how their body is working and how we need to improve that. So I've been doing that for about 5-ish years. And I love it. That's definitely my favorite part of what I do. So.
Perfect. Now, you said you went to chiropractic school?
Mm-hmm. Yeah.
How do those two things relate?
So most people think of chiropractors as neck and back doctors, right? But it's funny because when you're in chiropractic school, the chiropractic philosophy is very much encompasses the entire body. So we learn about nutrition, we learn about physiology, we learn, we have essentially the same schooling as an MD, except we learn how to adjust. So, and we have 1 semester of pharmacology. So obviously we're not learning anything about pharmacology in depth. So
pharmacology is
like drugs, okay. Prescription medication. Yeah. So, we learn more about nutrition. We learn more about, adjusting the spine. So chiropractic philosophy says the brain, the nervous system is our master system. It controls everything in our body. The old school chiropractors did lab work, worked on nutrition, adjusted people. We've kind of been put in this box of, the neck and back doctors. And so really when you're getting adjusted, it's just taking stress off of your nervous system and your spine. Mm-hmm. And so that's kind of how those two things correlate, is that when people come into my office, some people are already seeing chiropractors, some aren't open to it. Some, they don't need me, they're far away. So I don't adjust them. Mm-hmm. But I apply that chiropractic philosophy. The Wellness Way is a group of clinics across the nation where we call ourselves restoration clinics. We approach health issues differently than other people do. And so most of us are chiropractors, but there are some nurse practitioners. We've had nutritionists in the past join us. And so yeah, that's kind of how they align. I know people think like, you're a chiropractor. I'm like, yeah, I know. So I have to kind of explain that because people do put chiropractors in that box, but truly the founders of chiropractic were practicing like I do. They look at and how your entire body is working, not just adjusting your spine. So
I would have never thought. When I was reading about your background, I was like, I don't know why thank you for explaining that. Now tell me what got you fascinated with this? Like what made you be interested in helping women and in their wellness?
So my introduction to the Wellness Way is kind of a long story, but when in practice, like I mentioned in chiropractic school, you're in this bubble and you think you're going to heal the world with chiropractic care. And then you graduate and you leave and you're like, oh, people only care about their neck feeling better. Right. They're not really concerned about their health. And so the Wellness Way just gave me an avenue to have more tools for my patients so that I could figure out, well, how do I evaluate how their body is functioning? We get a little bit of that in school, but anybody will tell you if you're an MD, chiropractor, dentist, whatever, you learn in practice, right? That's really where you learn. So in practice, it was just like, I felt like I didn't have enough tools in my tool belt. I was missing a lot of pieces. And I really, really, really wanted to help women. So, I struggled with adult acne. I had issues with my gut. I had, I was somebody who like chronically had strep infections growing up. And then as an adult, it turned into sinus infections like every year, every single year.
Oh gosh.
And yeah. And I thought I was healthy. I thought, oh, well, I eat right and I take care of my body, but why am I having all these chronic infections? So it wasn't until I joined the Wellness Way that I really started to learn, the foundations of health, how to look into those things, how do you test for those things. I haven't had any issues with that since.
Good.
And so, yeah. So I don't know. I just saw a void in needing to give women better solutions, because in the women's health world, our solutions are, well, just cut it out, have a hysterectomy, or take hormone replacement therapy or take birth control. Oh my gosh. Or take birth control.
Yeah.
And so, and none of those things are necessarily bad. I'm grateful that we have access to those things when they're necessary, but they are our blanket solution, right? Like if you have horrible periods, you go to the doctor and they put you on birth control. And so I just thought, this is not right. There are so many things that you can do to address your hormones if you address your underlying health. So that's kind of a long story, but that's why I started doing more, focusing more on hormones.
Got it. So you mentioned adult acne and that you didn't face any of that once you kind of changed your lifestyle a little bit. Tell me a little bit about how, like if someone comes into the Wellness Way and they tell you, I have adult acne, will you help me? How do you normally help them? How do you treat them?
So we sit down and we do a very thorough health history. I usually spend about an hour in there, 30 minutes to an hour, depending on what they have going on. But we go through a health history. I have them fill out what's called a functional assessment questionnaire. So we go through that. We go through labs. Going through their history really tells me a lot. I don't think women, and not women, but just people in general, don't really put pieces together very well. They think like, oh, well, I've always had bad periods. That's just me. It's like, well, no, that is you, but that's not normal. Right. So, we kind of sit down, kind of dive through their history and then talk about testing. So what kind of testing do we need to have done? Not everybody, but most people that deal with things like adult acne, yes, it's going to be hormone related and it's going to be related to their gut. And so that's where we'll start with testing wise, specifically for somebody that has acne. So, stool testing, food allergy testing, hormone testing. We don't necessarily have to do all of that. We can just do a little bit at a time. But specifically for adult acne, that's what I do with patients when they come in like that.
Now, how long does it take typically, like if someone comes in maybe at the top of the, like the beginning of the month, would they know what's kind of wrong with them by the end of the month? How long does it normally take?
Yeah. So it depends on what tests you do. If we do blood work, I think that's what you're asking. Blood work comes back pretty quick. And so once the time between their first appointment and their second appointment, where we go through all that lab and all those testing, it's either anywhere from between 2 weeks and a month. And then, sometimes we do testing and we figure things right away. We're like, this is what's going on. This is what we need to do. This is how we need to move forward. Some people it's, well, we got a couple answers, we kind of peeled back the layers a little bit, but we probably need to do some more testing in the future. So let's start with this and then go forward. That's kind of what happened with me personally. After I had my fourth child, I had crazy acne. It just came out of nowhere. And so, redid my food allergies. Then a couple months later, redid my hormones, did a couple things a little bit at a time. And then finally it started to go away.
Wow,
man, adult acne is not fun. I mean, as a teenager, it's not fun either, but maybe it's like expected. Yeah. But as an adult, it's like, oh man, I would watch so many YouTube videos on like how to cover how to cover acne.
Oh man. Now, what would you say is the most common issue that people come in to see you for?
Oh man, that's hard. I would say there's a couple probably categories that I see a lot of. One of them is like anxiety. Oh my gosh, see so many women with anxiety. I see a lot of women that are in that, like they're approaching menopause, that phase. So I see a lot of that where people are having kind of hot flashes and vaginal dryness and low libido and, all the weight gain, things like high levels of estrogen. So if you have too much estrogen, that's usually either a liver issue, your liver is just not detoxifying your estrogens well. You have enzymes that recirculate estrogen. And so if those enzymes are too high, then that affects how you detoxify them. That makes them way too high. So, and then women that have thyroid issues, if you have thyroid issues, then that tends to interfere with your estrogen production. And so I see a lot of women that have really heavy bleeding and they're hypothyroid. And then they also have a tendency to be constipated. So I see a lot of those things go together, to where heavy bleeding is a lot of association with high estrogen, and then also thyroid and constipation. So not always, you may not fall in that category, but I see that a lot. I see those things kind of coincide a lot.
Now, you also deal with thyroid disorders. I'm having such trouble saying that. Thyroid disorders. Tell me how you diagnose that, or kind of what that means. What is a thyroid disorder?
So your thyroid is a little gland that kind of sits right here in your neck. And actually, one of the reasons why it's so commonly dysfunctional is because of where it's placed. So if you think about your heart's right here and your brain is right here, there's a lot of blood flow that goes back and forth between those two areas, right? Your heart has to pump a lot of blood up to your brain. Your thyroid is right in the middle. Glands are very prone to having like heavy metal deposition, calcium deposition, all kinds of things. So the thyroid is very easily affected. So the first thing I usually tell women is it's not your thyroid. It's usually something else. Something else is causing that disruption. But thyroid disorders usually will fall in one of two categories. I guess I should say three categories. So hypothyroidism, which is your thyroid is not functioning well. It's slow, it's sluggish. So you don't have enough thyroid hormone. That's why women have trouble, their hair falls out, they can't lose weight, they're just gaining weight for no reason, they're cold all the time. Your thyroid is your metabolic governor. So it dictates how quickly that metabolic response acts. So how quickly you warm up and how quickly you metabolize, things like that. Your thyroid affects every single part of your body. So that's why women will get put on medication if they're hypothyroid, because you could start to have dysfunction in a lot of places. So the other end of the spectrum is hyperthyroid, where it's going too fast. That is more rare. It happens. Definitely. I have hyperthyroid patients, but it is more rare. And then there's autoimmune. So that is probably the most common autoimmune hypothyroiditis. So your thyroid is being affected negatively because you have autoimmunity. Those are the women that usually come to see me because when you go to your doctor and they check your thyroid, they're usually not checking it enough, like checking enough markers. So they're missing some information there. And they, if you're hypothyroid, they put you on a medication to basically give you thyroid hormone. Essentially that's what they're doing. But if you're
I'm sorry. Now you said there's certain markers. So whenever I go to the doctor, they're always just like checking here real quick. Is that that's the only exam, or is that what they normally do?
A palpation exam is important, right? To feel your thyroid. Sometimes they'll like push your throat side to side. But I'm talking mostly about blood work.
Blood work.
Okay. So if you do blood work, they'll check levels like TSH, your thyroid stimulating hormone. But usually what's missed is the levels of T4 and T3, which are the thyroid hormones that are made. And then there are other markers that you can evaluate. But, if you're put on a medication to give you T4, that's a great Band-Aid. It's a great Band-Aid. But if it's not addressing, that medication is not addressing those antibodies that you have, right? That's an immune issue that isn't very well addressed. And so those are usually the women that come to see me because they're like, I've been on Synthroid for 5 years and I still feel like crap. Like, why, what's going on? And it's usually because they have antibodies and those antibodies just aren't being addressed.
Gosh, there's so much that can go wrong, or so many things that can happen I always hear a lot of people have autoimmune issues, but I never quite knew what that meant. Is it always mainly related to the thyroid?
No, there are
Oh,
lots of autoimmune conditions. I don't know how many, 100 or so, maybe.
really?
I do an autoimmune. I can do an autoimmune panel with patients. Sometimes we do that because they know they have autoimmunity and they've been checked for all the like very common ones, but nothing has come back positive. And I think my lab has 30. We
Mhm.
check for 30 different ones. So yeah, autoimmunity is very common between, the ages of 20 and 40 usually is when autoimmunity pops up. So, essentially what's happening is in the wellness way, we always say your immune system is not making a mistake, right? Your immune system is doing what it thinks it needs to do to protect you.
Mhm.
So that autoimmunity is a result of something going wrong in the environment, the environment of your body. And so addressing your immune system is a way that I help patients with autoimmunity.
Now, essentially, if someone wants to become, work at the wellness way, how would someone go about doing that? Do you have to become a chiropractor first and then kind of go the same route that you did?
No, actually, the Wellness Way now has what's called the Wellness Way Academy. So anybody can join the Wellness Way Academy. Now, once you graduate from the Wellness Way Academy, I think it's a year program. You can see consults, but that has to be under the oversight of a Wellness Way practitioner, somebody like myself. So you can't just go out and start, open an office all by yourself. You have to be under the guidance of a Wellness Way practitioner. But, you can be an MD, you can be a chiropractor, you can be a nurse practitioner, you can be a nutritionist, you can do the Wellness Way Academy. So you don't have to necessarily be a chiropractor or a doctor. We don't have any doctors in the Wellness Way, not because we don't want them, but just because the medical field has a very different approach to health
Mhm.
that we do. And so it's a lot of retraining, their mindset and kind of how to approach patients. So,
And now you're focused more so on holistic care. Do you follow that, same mantra in your own life?
oh yeah, definitely. Yes, for sure. Yeah. I have to practice what I preach. Definitely.
Exactly.
I'm not perfect, but yes, I try to eat organic. I try to, feed my gut good things. I try to, when I eat, I'm thinking to myself, is this fueling my body or is this hurting my body?
Mhm.
Do I, like I said, I'm not perfect. We're having a birthday party this weekend and I'm sure I'll have a piece of cake.
The
But
occasional treats.
yeah. But yes, I definitely do. I'm a mom of four, and so I definitely probably don't exercise like I should
Mhm, mhm.
and things like that. But yes, I definitely try to practice what I preach for sure.
Well, perfect, Dr. Cook. I appreciate you talking with us.
Yeah, this is
Hopefully,
great.
everyone's questions were answered. I learned a lot. Is there anything else that you'd like to share?
I don't think so. I will say that, I think women confuse common with normal a lot, especially when it comes to your period or like being menopausal or even like infertility. People think, oh, well, it's just super common, but that doesn't mean it's normal, right? So if you feel something off, use that intuition. We all have that intuition. We should listen to it that, something is not right in my body. If your doctor is saying, oh, you're fine, a lot of people experience that, follow that intuition and think to yourself, no, this does not feel right. I don't feel like myself.
Mhm.
All the people around me aren't experiencing this. And listen to that voice and go try to figure it out. There are wellness way clinics everywhere. I see people virtually too, but go find a wellness way and see if they can help you figure those things out, because you don't have to live that way. You do not have to live that way. Just because it's common does not mean that it's normal.
Yeah.
So
Now you mentioned that you see one last question. You mentioned that you see people virtually. Um,
yeah.
how does that normally work if you have to do labs or something? Do they just go to like a lab corp or something and kind of
Yeah. So Quest, LabCorp, most of the labs that I work with, I have like little kits and
mm,
I just ship you the kits. And then I get the results and we do everything over the phone. Yeah. And if you need herb, I try to get you, I try to be a one-stop shop so that I can provide everything that you need. And so then I can ship you all your supplements and herbs and things like that too. So
very cool. All right. Well,
yeah.
how can we find you on, do you have, Instagram or anything like that if someone wants to reach out?
Yes, I'm on Instagram at Dr. Beth Cook. I'm on Facebook too. I'm not over there as much, but I think it's the same handle at Dr. Beth Cook. But you can go to the Wellness Way website and look at all the Wellness Way doctors there. That's just thewellnessway.com. So yeah.
Perfect. Well, thank
you so much for having me. This was so much fun.
Good. Thank you.
Bye-bye.